The most common side effects include sexual dysfunction, which can happen in about 54 to 63% of people. Weight gain, which is considered to be moderate amount. Unclear exactly how much that is. Prozac, for example, is considered to cause a very slight amount of weight gain, and something like mirtazapine is considered to cause a large amount of weight gain. So Zoloft falls somewhere in the middle. Nausea, diarrhea, trouble sleeping, dry mouth, dizziness, low energy, sleepiness, and the next few are less than 10%, agitation, reflux, sweating, low appetite, and constipation. Next, here are some rare but serious side effects that you have to know about. Zoloft can cause low sodium levels in some people. It's estimated to be around less than 1% to 32% of people. Not really clear how often that happens, but it is known that people that are older, so older than 65, have an increased risk. Seizures, low blood pressure, mania, which means if you're already predisposed to bipolar disorder, if you have the genes for it, this could put you into a manic episode. And suicidal thoughts in people younger than 25 years old. I made a video all about suicidal thoughts and the risks involved with antidepressant use. Click on the video on screen here. I'll throw it up if you want to learn more about that. But briefly, the risk is about 2.5% of pediatric people, so young people at 4 weeks, may get suicidal thoughts if they didn't have some before that. Next, who can't take Zoloft? Well, if you have an allergy to Zoloft, if you've used an MAOI in the past 2 weeks, MAOI is a monoamine oxidase inhibitor antidepressant. It's one of the older antidepressants that doesn't play nice with other medicines. If you're taking pimozide or thioridazine, or if you're using the sertraline, aka Zoloft solution, which is a liquid with another medicine called disulfiram. And the reason why is because the sertraline liquid has a bit of alcohol in there, and this medicine disulfiram will make you throw up, will make you vomit if you have even a little bit of alcohol. So how does Zoloft work? Well, it works as a selective serotonin reuptake inhibitor. So it blocks the reuptake of serotonin. That means there's more serotonin for it to work at the receptors. It also weakly blocks the reuptake of dopamine. It's not even strong enough to be a controlled substance, so this is a very small amount. And it also binds to sigma receptors. Sigma receptor binding has been shown to be very helpful in anxiety disorders and OCD disorders. Here are some of the uses for Zoloft. There are some FDA-approved uses: major depressive disorder, OCD, panic disorder, post-traumatic stress disorder, which is what PTSD is, premenstrual dysphoric disorder, and social anxiety. And it's used off-label, meaning there's evidence to say it helps, but there's no FDA approval for generalized anxiety disorder and social anxiety disorder. Here's how we dose Zoloft for major depressive disorder. We start at about 25 to 50 milligrams daily, and you can take this before bed nightly or in the morning. We increase by about 25 to 50 milligrams weekly, but that is very aggressive. Usually increases aren't made that quickly. Usually increases are made anywhere from 2 weeks to 6 weeks. And the increases are made if you're not noticing improvements. And the max dose of Zoloft is 200 milligrams. However, one can sometimes go up all the way to 300 milligrams. So how quickly does Zoloft start working, and what do we need to monitor while taking this? Well, for depression, it starts working in about 2 to 4 weeks. This is pretty typical with most antidepressants. The antidepressant exception with that is ketamine or Auvelity, which is dextromethorphan and bupropion combination. Auvelity starts working in about a week. Ketamine can work in about a day sometimes. For monitoring, we actually don't need to monitor any labs if you're a healthy person. If you are a bit older, we should monitor your sodium levels. Because of what I mentioned earlier, it can sometimes cause low sodium. We should monitor your weight because Zoloft can cause a moderate amount of weight gain in some people. And did you know you can actually get a blood level of Zoloft? It costs about $136 at Labcorp, and the normal range, if you're taking this, is anywhere from between 10 to 150 nanograms per milliliter. There's no specific lab range that you need to get to for it to work. But this can be helpful. Let's say you're at the max dose of Zoloft and you're not noticing any improvements. We could get a blood level, and let's say your blood level is at 10 or lower. Then we're saying, well, we're at the max dose of Zoloft. Why is that happening? That's weird. And that may be due to your genes. You may be a hypermetabolizer of the enzymes that Zoloft is metabolized by. And so you're breaking down this medicine way too fast, and that's why your blood levels are so low, and that's why it's not working. Here are some positives and negatives regarding Zoloft. Well, it's great for anxiety and OCD and many other disorders. We saw the FDA approvals. So that's great. If you're taking it for mood, it may help other conditions as well if you have those together with your mood disorder. It doesn't cause hardly any drug interactions itself, which is great. So it plays nice with other medicines. And it's cheap. It's generic, $17 for a month's supply. But one of the negatives, it does cause sexual dysfunction in about 50 to 60% of people, and it can cause a moderate amount of weight gain. If you enjoyed this video, you might also like this video on screen next. Auvelity, a newer medication that has a different mechanism than all the other antidepressants that we know, and it works quicker than some other ones too. I'll see you over there.